Hello, welcome to another edition of Hypnosis Helps with me, Neil Myers, hypnosis practitioner. And this is a topic that I've been wanting to talk about on a show for a long period of time. So why haven't I, you asked? Well, the reason I haven't is because the topic is actually quite big, it's quite involved. I'm going to be talking about this over probably at least a couple of shows, maybe 3, and the topic is hypnosis in relation to fertility. Sometimes people talk about it in terms of infertility or sterility, but I'm really talking about it in terms of, I prefer to call it fertility, so hypnosis in connection with fertility. Now, I'm going to spend a lot of time talking about fertility as a general topic, about hypnosis studies, what we know, what we've learnt, and this is going to be quite involved and quite detailed, because for those of you who are struggling with issues connected with fertility or infertility, in other words, you want to have children and you're having difficulties having children, or if you know anybody in that condition, and it's a very common problem. There is a whole industry, which we're going to talk about at some length, built around the difficulties of conception. And it's a problem that affects many women in this country, and of course their partners. It's not just something that is experienced, of course, in this country. Across all of the world, people have difficulties or can have difficulties in conception. And so the first thing I want you to know, before we go into the details, is that hypnosis is an extremely powerful and effective way of helping you become pregnant. That's the first thing that I want you to know. And the background of all of this is to describe how, why, what's done, what's effective, what isn't effective. But that is the first thing that I want you to know. And it's not just me saying that. What we're going to be doing today and through the course of the next show and possibly the show after is examining the evidence, the effects, the methodologies, why, how, what's effective. Now, I just want to say as a background to this is that it's so effective in relation to people who are struggling with issues of fertility, of conception, of not only, of course, getting pregnant, but giving birth to a healthy, live, of course, baby. It's so powerful that I'm really shocked that it's so little understood. In fact, most people, the vast majority of people, have no idea whatsoever that hypnosis and this type of work can be of any benefit at all in this regard. And the shocking thing for me is not that they don't know it, but there's been so much work done and so much study showing just how effective it is. Now, the first thing that I want to say as a background to the whole topic is that when we are talking about hypnosis in relation to fertility, conception, pregnancy, and eventually, of course, a live and healthy birth. This is live television, folks. That's my cell phone. And the first thing I'm going to do is turn off my cell phone. So it's, you'll forgive me. Let's, modern technology. I thought I'd already done that, but let's turn that off. And so we don't have any issues. You'll bear with me for one moment. There you go. Phones are off. That this is relevant and important where there are no truly organic issues which are presenting or preventing pregnancy. Now, I want to be a little bit careful here when I talk about purely organic issues, because one of the things I want to address is that it's not just a question of this definitive separation of organic and non-organic, of emotional and organic. It's just like that. There's more to it than that. However, let's take some really, really obvious things, almost absurd, but let me make it really clear. However powerful my hypnosis is, I don't think any hypnosis practitioner, to my knowledge, has succeeded in creating pregnancy in a man, because it's not physically possible, obviously. Clearly, if a woman has truly passed and entered menopause and is no longer able to produce viable eggs, then of course we're not talking about that sort of effectiveness. And of course you can all think of other things. I'm sure there are many, many others where, and I don't need to list them, but where it's clear that there is an organic reason where conception is just not possible. For example, one of my clients' spouse has not produced any testosterone since forever. Basically, it's an organic problem, and has forever had to take testosterone supplements, and to my understanding is for that reason impotent. Truly, there is a physiological reason, and it doesn't matter what I would do, that person, even with the healthiest woman, is not going to be able to conceive. That's just the nature of it. But we're not talking about cases like that. We're talking about cases where there doesn't appear to be any real organic reason or why you, as a woman, if you're a woman watching this who wants to get pregnant and have a child, should not be able to get pregnant. There's no problem on either side, but for some reason, after repeated tries and a long period of time, you can't get pregnant. That's what we're addressing here. And so I want you to know, first off, that if you find yourself in that situation, hypnosis for that purpose represents one of the most straightforward, easiest, completely non-invasive, compared to the costs of assisted reproductive therapy, sometimes called ART or ART, extremely much cheaper, frankly. And very, very powerful, very powerful. So that's what I want you to know. But before we get into all of those details, we need to set the background. I have spent quite a few weeks, in recent weeks, looking at studies, at books on reproductive therapies, and of course particularly reproductive therapies in relation to hypnosis. And one of the things that struck me looking at all of this is that very often the basic background was not set. And what I mean by that is why the question was not really addressed. Why could hypnosis be effective at all? Why should it be effective in these things? There was a lot of the modern literature, and some of the older literature seems to skirt around the question, or it mixes up all sorts of strange conceptions, making it very, very unclear. And I want to be very, very clear here as to how we can help. In the next program, probably, we're going to be getting into the nitty-gritty, the very details of what an effective program looks like. But here you need to understand the conceptual basis, because if you don't understand that, you're not going to be able to, I'm going to drink some coffee here, you're not going to be able to make a choice as to whether you want to experiment, try this methodology. And I'm really strongly encouraging people who are watching this to give it a go. If it's within your financial resources and there's somebody nearby that can help you, or you want to travel to see me, depending upon where you are, or one of my colleagues, really, really I want to encourage you to consider this very, very carefully, because it may be the answer to a problem which you've been trying to solve for a long time. So what's the conceptual background? The first thing I want to talk about is whether hypnosis can have an effect upon the physical. Now, in conventional medicine, therapy, and even the way we think of things, we tend to divide things in certain ways. We talk about the physical, we talk about the mental, the emotional, the psychological, the spiritual, and there's a tendency to think of these things in boxes, separate things which don't really seem to be linked. And particularly, one of the things that we separate when it comes to medical issues is the physical, the emotional, and the mental. Now, the interesting thing is that when you speak with most doctors, most intelligent doctors, they will always acknowledge that there is an emotional and mental component to most illnesses. They don't exist just in a physical isolation. Now, of course, there are some things which are clearly physical. I've given on this show, and will give you now, some very, very obvious examples which are clearly physical, which have nothing to do with emotional work, mental work. Let's take some really, really simple ones just to make it stand out very clearly. As a human being, if I was to stop drinking water, or you were to stop drinking water for 7 days, or probably even less, we'd be dead. There's no amount of hypnosis that's going to help us with that. With diseases of nutritional deficiency, there's no amount of hypnosis or mental work or emotional work that's going to help us with that. If you or I have insufficient ascorbic acid, vitamin C, we will develop eventually scurvy. If we have insufficient vitamin B3, niacin, we will develop pellagra. If we have insufficient, I think, vitamin B1, we'll develop beriberi. These are conditions of insufficiency. And there's no amount of mental or emotional work that's going to help with those. They are purely in the realm of the physical. And if we have sufficient quantities of those, unless there are some very, very other strange and unusual metabolic problems, but in a normal human being, we won't develop those diseases. And quite simply, if we drink water and we remain hydrated, we'll stay alive. However, outside of those specific realms, I believe, and I've talked about it on this show many times in many aspects, there is a very, very strong and powerful link between the body and the mind. In fact, I would go so far as to say that it's extremely difficult in certain instances to draw a distinction between the body and the mind. They seem to be, there is an intimate link. You can see this at certain instances on in the nervous system. But even in the simplest way, let me give you 2 really simple examples. We know that when blood sugar levels are low, we experience emotionally maybe a lack of energy, right? And this is a physiological effect, of course. Let me give another simple example of where the emotions have a clear effect upon the body. The simple one that we're all familiar with, the experience and the observation of blushing. If we blush or somebody else blushes. By the way, I don't know if you can hear that, but for the folks in the studio, there's a noise in the background that we can hear you talking. So I don't know if it's coming on the air, but I can hear it. Anyway, let's take blushing. Something embarrasses you, or you see somebody who's embarrassed by something, or nervous about something, shy about something, and their face begins to redden. Now, of course, we can describe that process in detail physiologically, the blood vessels opening and the reddening of the face. Of course we can. And we can give it a description, but that's a description of what's happening. The reason it's happening is because something has affected them emotionally, and the emotional effect immediately transfers to the body. And it's not something that they can control. Most people can't control whether they blush or whether they don't blush. It happens whether they want it to or not. So this demonstrates a clear link or a clear example that is commonly understandable by all of us of body and mind. Now, in the early days of hypnosis, when I talk about the early days, I'm not talking about the earliest time back in ancient history. I'm talking about from about the middle of the 1800s and onwards, where there was a rise in interest in hypnosis. From that period of time, people were absolutely fascinated by hypnosis and physical effects. They were more interested really in the physical effects than in the emotional effects. When we talk about hypnosis today, we normally talk about emotional aspects of it, because the modern conception of it is that it's something that exists as a way to help people with various emotional problems. But the first researchers in hypnosis didn't think this way at all. You've heard me mention before, and if you haven't, because you haven't watched this, or this is the first time, the work of Esdale, an English surgeon working in India in around about the 1840s, who used what he called mesmerism, which we would term hypnosis today, specifically for the purpose of creating anaesthesia in the days before there was any chemical anaesthesia. So he wasn't interested in the emotional effects. Although he recognised that there were emotional effects, of course, he was interested purely in the physical effects of hypnosis. Later on the Nancy School in France, the professor, I think it was Professor Bernheim and Dr. Leobeau, or it might be the other way around, but Bernheim and Leobeau investigated all sorts of phenomena of hypnosis, and they were very, very, very interested in what happened physically in hypnosis. In fact, one of their leading students, a man called Emile Coué, working in the early part of the 20th century, who you've heard me mention before. Most famous, I think, if you've ever heard the phrase, "in every day, in every way, I'm getting better and better," that phrase and that suggestion, at least in its French form, because Coué was a Frenchman, was one of the things that he was most famous for. But there was a whole school of what was called Couéism. And in one of his books, this is a book written, I think, in 1925, he talks about autosuggestion and organic disease. And he puts this, and even here he addresses the problem. The statement is often made that autosuggestion cannot cure organic but only functional disease. But if so, why does a wrong mental attitude cause it? He raises the question. But the first thing he mentions is he talks about the case of ordinary warts. They are very decidedly organic, yet they are produced by and yield very readily to autosuggestion. Even today, it is well known that warts, which as far as we can tell are a viral infection, respond really, really well to autosuggestion. This has been long established, and by autosuggestion we mean a branch of hypnosis. This isn't new knowledge. I'm not the first person saying this. This has been tested repeatedly for decades. And he goes on later to talk about this, and he talks about it. And he says, the part played by autosuggestion, and he's, again, when he's talking about autosuggestion, we can also encompass hypnosis, in the cure of a disease can be readily understood when the unconscious, and I would prefer to use the term subconscious, self is the grand director of all our functions. Now, what does he mean by that, and what do I mean by that? I've stated, and you've heard me say, and I repeat again, that the subconscious mind is the grand director, the intelligence of our physical function. And that includes the brain. A great deal of modern research is focused on the brain and how the brain works. But I would say that the brain, being a part of the body and under the hypnotic model that you've heard me describe, is under the direction and control of the subconscious mind. And again, that isn't something that's particularly new or revolutionary. This is recognised. And in fact, some illnesses are recognised as purely the result of the mental and emotional state. Psychosomatic illnesses, psycho of the mind, somatic of the body. So the condition of the mind and the emotions reflected in the body. We've talked about the fact on previous shows that conventional medicine has long recognised that there are emotional and physical links in many, many diseases. Again, another obvious example and a common one is that of asthma and eczema. When I was young, a little while ago, but it was fairly commonly recognised by the most conventional doctors that asthma and eczema had a psychological, emotional aspect, not just a physical aspect. And again, so none of this is exceptional or strange knowledge. However, the degree to which the mental and emotional processes affect the body is surprising to most people, including hypnosis practitioners, unless specific things are demonstrated. And I want to refer again to another very helpful book which you've heard me mention many times, or actually you've heard me mention many times the work of Dabney Ewing, Dr. Dabney Ewing. And I want to remind you here about something that Ewing observes. Ewing is a burn specialist, a burns doctor. He's not somebody who's only interested in hypnosis. But he has demonstrated over the course of many years how effective hypnosis is in preventing the acceleration of a burns process. And he mentions that when somebody is hypnotized, within 2 hours of a burn, the bradykinin, the enzymes that cause the inflammatory condition, can be inhibited. And he says that when the inflammatory part of a burn is aborted, the burn does not progress from first to second degree or from second degree to third degree, and there is minimal pain during healing. Now, even more surprising, he mentions a film that is familiar to some doctors and many hypnosis practitioners, a film which was from 1982, so we come right up to more modern times, by a doctor called Dr. Chertek. Now, what does Dr. Chertek do? He puts a cold coin on a patient's forearm, and he suggests that the forearm and the coin is hot, and that because it's hot, it will cause the forearm to blister. And what happens is exactly that in the film, that the skin blisters in response to the suggestion, fully accepted and believed, that it's going to produce that effect, and the body responds as if it was happening, even though the coin is cold. Now, that work done in 1982 was a demonstration of something that had been well known to hypnotists probably since the 1880s or even before. Because that type of demonstration with cold objects or cold coins, when the body blisters in response to what it thinks is a heat stimulus, is very dramatic but quite well known. Dr. Dabney Ewing uses that process in reverse to send suggestions to when an area of the body has been burnt physically. The suggestion is sent that the area becomes cool and it inhibits the inflammatory responses. But this is measurable in the enzymes that are inhibited from going to those areas to cause an inflammatory response. So again, when I talk and describe hypnotic processes as having a physical effect, this is not just fanciful talk or imagination on my part or any others. This has been demonstrated many, many, many times. How does this relate to infertility? What I'm saying is that a properly conducted program, conducted in a way that is aimed towards the problem of conception, fertility, infertility, sterility, can change physiological responses. Not can, but demonstrably does in a very high percentage of cases if it's properly conducted. And I'm going to be talking about that in the next part. So I want it to be clearly understood that when we're talking about hypnosis in relation to fertility questions, we are not only talking about an emotional, psychological, mental attitude towards conception, childbirth, or anything else. Of course, we're going to talk about cases where that's a very, very big component and an important component. But what I want to really make clear is that it is those emotional, mental attitudes, ideas, conceptions deeply held in the subconscious mind which have a physiological effect, outcome in inhibiting, preventing, limiting, and in some cases and very often entirely stopping the possibility of healthy women becoming pregnant and healthy men with healthy women conceiving together. Because where there's a healthy man and a healthy woman and there are no physical problems, if they have sex at the appropriate times of ovulation, conception should happen. That's the basic thing, and that comes back to a really, really basic thing that I've spoken about many times in hypnosis, is that what hypnosis does, or what we are doing, is helping facilitate natural processes. You've heard me talk on other shows about hypnosis and physical healing. Physical healing is a natural process. If I cut my finger, what I then have to do is create conditions where healing takes place. I have to clean the area. Perhaps I have to, if it's a deep enough cut, put a stitch or a suture on it to hold the skin together, protect it, make sure it's clean, make sure it's free of infection. And if I create those conditions, then the body will heal. I don't actually make it heal. The body has its own healing mechanisms. And I would say not just the body, but the body and mind working in harmony. You've heard me describe how we can accelerate and increase that process. You've heard me describe how personally, even when I had a broken collarbone, how I used hypnosis and other things to accelerate a healing process. And again, there's nothing new or revolutionary about this, it's just not as well known. So when hypnosis helps with infertility, it helps conception, it helps women become pregnant, it helps them have a live, healthy birth, it's because it's facilitating a process that is already there, it's already natural, it's already built in. That's the first thing. Now I'm going to talk in this show and in subsequent shows about some of the studies that have been done in connection with hypnosis and fertility. I'm offering that as what I would call the evidence, the proof that this is something that is effective. It's something that if you're experiencing difficulties in conception, you should seriously, very seriously consider trying. But I want to say something first about the nature of evidence, the nature of tests in connection with hypnosis, and why you should look at least some of them, particularly some of the negative or limited ones, with a degree of questioning and skepticism. Because there are things connected with hypnotic research and knowledge which are frequently really not addressed or mentioned. Now it may appear that as I address these questions I'm actually undermining my own arguments, but if you bear with me you'll understand why I need to address these important questions. So let's talk about just general tests, scientific experiments to determine whether something is effective or not. Now, for those of you who have listened to medical programs or other programs, you'll probably know that the scientific and particularly the medical community is in love with a particular form of knowledge transmission and research called the double-blind study. The double-blind study is very often held up as the gold standard as to whether something really works or doesn't work. It's held up as such a gold standard that it almost appears that if you can't do a double-blind study on something, it can't be real. It can't really happen. It's not proven. We don't know. And I have to say that this is an extremely limited outlook. But let's talk a little bit about it and why I believe that that whole notion is deeply flawed. Now let's talk about the double-blind study. What do we mean by that? What's generally meant is that a test is made, usually involving a substance or sometimes a procedure, in which groups are chosen where some are given, let's take an obvious example, a pill. Let's make it simple. Some are given the real deal, some are given a placebo, a sugar pill or something that doesn't contain any of the active substance, the substance that is attempting to be researched. And the purpose of that is to see whether the real substance outperforms the placebo. In other words, whether there's a real effect. That's one part of the blindness. The people receiving it, the patients, the people who are the subjects of the experiment, don't know whether they're getting the placebo or the real thing. But the double aspect of the blind test is that the people giving it to them, the prescribers, they also don't know. That's the double blind. So the idea of that is it's to protect from any possibility of anything else happening. You're just testing the pure substance. And on a superficial examination, that would appear to be the finest and perhaps the only credible standard of testing as to whether something's effective or not. And so I hear time and time again, oh, unless a double-blind study has been done on this, well, it can't be real. Even if it's effective, it's purely anecdotal. It can't really have happened. But there's no double-blind study. Well, let's examine that, because I'm going to challenge that idea. If you're testing something like a potential new medication, then a double-blind study is an excellent test, probably the best test that you can use. However, up until relatively recently, medical knowledge, as an example, was not transmitted through the double-blind study. It was transmitted through case studies and casework and doctors communicating with each other. Quite simply, a doctor would try something, experiment with a procedure, and then they would write up the case, describe what they did. Other doctors were then invited to experiment in their own practices, usually with their patients, and then report back. And a body of knowledge was built up. This is how we've discovered, or how doctors discovered in the past, how all manner of things are effective. And if one considers this just in a very, very practical, simple way, it's really how we transmit all types of knowledge. So, for example, if I'm baking a loaf of bread, and I'm a baker, and I find that a particular mixture uses 13 ounces of water rather than 14 ounces of water, and that produces a better mix, I might report it. And you, as a fellow baker, might go out and test it, and you might find that under other conditions 12 ounces produces something else. And we go backwards and forwards, and eventually we find that a certain ratio of flour to water to salt to yeast, a certain rising time and a proving time, produces the effect that we want, and we pass this knowledge on between us. And the result is that we can, if we follow the same procedures, we can consistently bake a loaf of bread. For that knowledge to be transmitted, it is not necessary for me to do a double-blind study. I don't have to have somebody with a substance called flour and another substance and not knowing which one is, or one's using water and the other one's using some form of acid, or somebody's using yeast and somebody's not. It's not really necessary to do all of that to bake bread and to make a loaf. And that's how the knowledge of doing a simple thing like baking bread or any knowledge was transmitted. And in a similar way, this is how doctors found out what to do. Now, here's an area of medicine which doesn't use double-blind study at all. Surgery. Of course, there can't be a double-blind study in surgery. It would be impossible. Could you imagine the absurdity of a situation where you had somebody and they were going to try a new surgical technique, but they didn't know which patient had the problem and which didn't? Perhaps, sometimes they'd have a real surgeon and sometimes they'd just have somebody from the street. Of course, that's an absolute absurdity and it's a joke. So how does surgical technique improve? Well, quite simply, a surgeon tries something, experiments with something. Maybe the case is particularly difficult, tries a new procedure, and then, just in the way that knowledge was transmitted, describes what he or she did, describes it to other colleagues, and they're invited to try it and report back. And all our advances in surgical knowledge and technique have come about in that way. Trial, error, experimentation, refinement of technique, transmission of knowledge. They have absolutely nothing to do with double-blind studies. But nobody would question, I don't believe, the effectiveness of particular surgical techniques. Some of the most refined and difficult surgical techniques have never been the subject of any double-blind study because, of course, you can't do a study like that in those processes. But it doesn't mean that we can't know that something is true and knowledge can't be transmitted. So, when we talk about hypnosis and hypnotic effects, we can't really do anything approaching a double-blind study. But that doesn't mean that we can't know that something's effective or not effective. Now, there are two other problems that I want to address in dealing with hypnotic studies and studies as to whether hypnosis is effective, which we're going to be talking about, as I say, maybe not in this show, but in later shows, because I notice time is going. One of them that is often completely ignored is the simple question of what are they actually doing? The term hypnosis is used, but I'm sorry to say that hypnosis is not something which has a universally agreed definition. So you've heard me describe on this show what one person describes as hypnosis, what one practitioner describes as hypnosis is not what another one would describe as hypnosis. You've heard me address the fact that some things that people call hypnosis, I would not call hypnosis. Some people refer to creative visualization as hypnosis. I do not believe personally that that's hypnosis. I don't believe also that creative visualization doesn't have a purpose, but it's not the same thing. So when people talk about a hypnotic study, one question that we have to ask, both as hypnotists and as lay people trying to solve a problem, is what actually did they do? Was it hypnosis in the form that I understand it? You've heard me mention on previous shows about so-called hypnobirthing, which uses hypnosis. But some of the techniques of hypnobirthing, in my mind, don't use any true or real hypnosis at all. And consequently, a lot of them are extremely ineffective. By contrast, those that are using what I would define as true hypnosis are very effective. So that's the next thing one has to consider. When everybody does a test of hypnosis, what are they actually doing? Now this leads to the next question, which in many ways I believe is the most ignored and yet probably the most important. And I'm going to give you a sort of an absurd example to put it in context. But it's one I use frequently when I'm describing what I do and its provability and its test. I don't know how many of you watching this are golfers or have attempted to play the game of golf, but it can be a wonderful pastime and sometimes incredibly frustrating. Some of you out there are professional golfers. But let me pose a particular test. Let's pretend that I was to choose 1,000 people at random, and I was to give them a very fine set of golf clubs and put them onto a golf course with some balls. Now, of course, some of those people are probably going to be golfers, but the vast majority of those people are going to not be golfers and never have played the game before. Some of them will have played it, but play it very badly. And here's the hypothesis that we're testing, that it's possible to go round an 18-hole golf course in 70 strokes or less. That's our scientific hypothesis, and we have a sample size of 1,000 with the finest equipment. By the way, what does that mean? That means that if you've never played the game of golf or seen it, when you hit a golf ball from the tee to the hole, you're supposed to get it in a certain number of strokes called par. 4 shots, 3 shots, 5 shots. And if you combine those, then the par for a course might be 70, 71 or 72. That's the standard. So that's our hypothesis. Now, what would I find? What would any of you find if you took 1,000 people at random? What you're going to find, my guess would be, is not one single person will be able to go round that golf course in 70 strokes. In fact, the average person would be lucky to go round that golf course in 200 strokes or even more, and probably lose a couple of dozen golf balls or more in the process. Even somebody that had played golf would be able to perhaps go round in 80 strokes. But the hypothesis that we were testing, that it's possible to go round a golf course in 70 strokes, would be null. We failed. And so we could write up our experiment and say, on a big sample of 1,000 people, we've determined that it is impossible to go around a golf course in 70 strokes. Now, of course, you've probably all spotted the absurdity of this, which is that what was been assumed is equal levels of skill. And if anybody that watches television, sports television on the average Sunday, you can watch and you can see dozens of skilled professionals going round a golf course in 70 strokes or less. It's no big deal if you're a skilled professional golfer. And that's the key, skilled. There are differences in levels of skill between golfers. A professional golfer can easily go round in 70 strokes and less. Somebody that's never played golf would barely go around in 200. An average golfer may be in 100 or 90 strokes. What we're talking about is differences in level of skill. Hypnosis is a skill, not just of me, but also of the client, which I'll come to later, me as a hypnosis practitioner. Are all hypnosis practitioners doing the same thing? No. Are all hypnosis practitioners equally skilled? Absolutely not. There are huge differences of skill between hypnosis practitioners. Some, I'm sorry to say, are, I would term, almost entirely incompetent. Some, like my mentor, the late Stephen Parkhill, exhibit levels of skill which are absolutely extraordinary and therefore produce extraordinary results. So if a test is done without taking account of the methods of hypnosis or the skill of the hypnotist who is conducting those methods, they won't mean very much. Let's come back a little bit to surgery. I believe the first person to do a heart transplant was the South African surgeon, Dr. Barnard. Christian Barnard, I think was his name. And at the time that surgery was done, he was probably the only surgeon in the world at that time skillful enough to be able to do it. He and other surgeons transmitted his techniques and described them. Other people were trained in it, and of course now there are many people in the world that can perform that. Let's take any other form of surgery. One of my clients was he still sells heart valves, and he sells heart valves wonderful pieces of technology that replace a faulty valve, and he literally knows every single heart surgeon on the East Coast. It's his business to do so. And I asked him once about that. And then I asked him about pediatric heart surgery for children. And he said, oh, very, very few people can do that. And I said, really? Because I didn't know. How come? And he looked at me with shock and he said, how come? He said, you're dealing with a tiny, tiny, tiny organ. He says the skill required in doing that is very, very considerable. Me being an ignoramus about these things, I didn't realise that. And he said, you just have to look at a phone book or a list, a directory of surgeons. You'll find lots and lots and lots and lots of heart surgeons. You'll find very, very few pediatric surgeons because it's very, very difficult to do. Why? Because you're dealing with tiny, tiny things. What does that mean? It means that the surgeon, however knowledgeable, who performs that type of surgery successfully has to be much more skilled, of course. And that's recognised in the profession. And it's recognised that the most skilled surgeons will often do the most difficult things. It's clearly recognised. Of course, for other procedures, which are frankly easier to do, less skill is required. And in many, many, many other fields, it's recognised that higher skilled people can do more difficult things. There's a recognition of differences in skill. None of these, this sort of thing is taken account for in double-blind studies. Why? Because it's irrelevant to that type of study. But it's absolutely relevant to you if you're going about the process of selecting who and what that person is going to do, what that hypnosis practitioner is going to do, what that professional is going to do when it affects you and your capacity to become pregnant and to have a healthy pregnancy and a live birth. It's really, really important because skill is not equal. And what that means practically is where one hypnosis practitioner given a set of conditions can be skillful and effective, another hypnosis practitioner may not be effective. So whenever you look at studies or whenever you hear as to whether a hypnosis can be effective here or there, the two questions I want you to consider and I want you to ask is, what were they doing actually? And secondly, how skilled was this person? Now, I am going to be speaking about studies where hypnosis was done not just in the form, in any old way it was done. I'm going to talk about hypnosis done in a particular way and what the effectiveness of that is. In fact, I'm going to talk about that in detail, I think, on our next show on the evidence. Now, a lot of the information that has been collected about hypnosis and studies in relation to fertility and infertility is quite nicely put together by a gentleman called James Schwartz, who's a hypnosis practitioner, who's written a nice book, Mind, Body, Fertility. Here it is. I'm very grateful to Mr. Schwartz for the work that he's done, for bringing things to public knowledge, and he describes some things, and some of those things are wonderful. However, I can't say that I am completely uncritical of some of the things that Mr. Schwartz has presented, and I'm talking about this purely in a professional sense. I don't mean it in any sense personally. I'm sure he's an excellent fellow. Now, one of the first things is that Mr. Schwartz states very, very early in the book is that he talks about the fact that the first study on this topic, hypnosis in connection with fertility, that he can find goes back to the 1970s in a book called Psychosomatics, written by Doctors Howard and Martha Lewis. And he describes that as it kind of goes back to the 1970s. And I have to say that I don't know quite what research Mr. Schwartz did, but on this he is absolutely incorrect. The first study that I am aware of that was described, and I'm not even saying it's the first study because I believe that there's a high likelihood that things were done before that, was actually described in great detail of a study done in 1952 of 20 cases, and of course the person who is behind that study or connected with that study is somebody you've heard me mention before, Dave Ellman. Now the great Dave Ellman, one of the most probably the most important figure in the 20th century in hypnosis, only taught doctors and dentists and psychiatrists, doctors again. Mr. Ellman didn't teach anybody else. That was what he aimed to do. And Mr. Ellman describes the first study being conducted by doctors who he had taught, a group of doctors in 1952, involving 20 cases, and they wanted to find out whether it was possible to for hypnosis to be effective in cases as they described them at the time, the terms they use of sterility, infertility. That's what they wanted to find out. So we're talking about something that happened way before the 1970s. Now, why isn't this mentioned in Mr. Schwartz's book? Well, I hope I'm going to be kind to Mr. Schwartz, but quite simply, I guess he just didn't know about it. Why didn't Mr. Schwartz know about it? Well, I don't know, but one of the names that's not mentioned in Mr. Schwartz's book when it comes to hypnosis at all is the name of Dave Ellman. Unfortunately, like many modern day hypnosis practitioners, Mr. Schwartz seems to have a complete blind spot when it comes to the work of Dave Ellman. Even though Dave Ellman was teaching and taught thousands of doctors, and those thousands of doctors did tens of thousands of experiments, case studies, work using the methods that he taught. It's almost entirely been forgotten, like it didn't exist. The reasons for that we can go into in a different program. But I want to let you know that even then, his methods and the work that he was doing, Dave Ellman, was effective. So what happened in these 20 cases? And again, what I'm going to describe, I'm sure that there are many scientists can pull holes in how these experiments were done and what was done. But again, we're talking about a group of 20 doctors, serious-minded professionals. What did they do? They followed 10 couples over the course of a year. And those 10 couples who were having difficulties, there were no physiological problems, there were no organic problems. 2 of those couples had a healthy, live baby. The woman became pregnant, she gave birth to a live baby. They tried a hypnosis process, a specific process, on the other 10. And they followed their progress over the course of the year. And 8 out of those 10 became pregnant and gave birth to a healthy, live baby at the end of a year. Now they repeated that experiment many, many times, and I'm going to go into details about some of the things that they did later on, and I'm going to go into details about exactly what they did. But just consider that for a moment. 8 out of 10 in 1952. By any statistical method or account, that is an extraordinary result, and one that bears further examination, and one that is important for you to understand. So as early as 1952 and through the 50s, the 60s and the 70s, before the work of those doctors that Mr. Schwartz describes, doctors were actively using these methodologies to help men and women have a healthy child together. So it's not new what I'm describing. It's not some fantastical knowledge. It's not something that is completely unproven or nobody has experimented with. But did they do a double-blind study? Of course not. What they did is they came up with a protocol. They did some experiments in this way. They passed on the methodologies to other doctors. Those doctors did it. Now, what's one of the key factors here? All of these doctors that did this experimentation and used these methods were trained in the methods of Mr. Ellman. So we know what they were doing. Were those doctors all equally skilled in their application of these methods? Of course not, because medicine is a practice of skill. Some people will call it an art and science combined. Hypnosis is a skill. Yet, the consistent results show that when these methods were practiced by people who were properly trained and skillfully applying them, they had an enormous effect on creating or on stimulating the fertility in these healthy people. And the result, a healthy baby. So, in the next program, what I'm going to be doing is I'm going to be talking more about exactly what Mr. Ellman did. I'm going to be talking about some of these other very, very valuable studies and what they've demonstrated and what they've shown. And I'm also going to be describing, if we have time in that show or in another show, how I work and what my program is, working with couples who are looking to have a healthy child, a healthy pregnancy, and have been having difficulties with that for no immediately apparent organic reason, and how that can help you if you find yourself in a similar condition or you have friends or loved ones, and how this very, very valuable tool, which is not well enough known about, can be known by you and others. So until that time, thank you very much for watching this edition. I hope it's been helpful. I hope you'll stay with me for the next one and the ones afterwards. And until that time, be healthy, be happy, and come back and watch another edition of Hypnosis Helps. This is Neil Myers saying